All right, today we're diving into one of the most fascinating puzzles in all of clinical neurology, Alexia, which is sometimes called word blindness. It is just a beautiful condition because it shows how a simple observation you can make at the bedside can lead you straight to a very specific, very complex circuit in the brain. So let's start our investigation. This quote from a real patient gets right to the heart of the mystery. I mean, how is that even possible? It sounds like a complete paradox, right? But, as we're about to see, it makes perfect neuroanatomical sense once you understand how the brain is wired for reading. So to really unpack this, let's ground our discussion in a clinical case, a story that really brings this puzzle to life. Let's imagine Mrs. Jensen, a lifelong English teacher. She wakes up one morning after a really sudden bad headache. She looks at a book, and the words on the page might as well be a foreign language. She can see the letters, they're perfectly clear, but they just don't come together to form words in her mind. And here's the really wild part. Even sentences she writes herself become completely unreadable the second she's done writing them. So on exam, we start gathering our clues, like detectives. She can't read words, okay? But her ability to write, it's flawless. You talk to her, she understands you perfectly, so we know this isn't some global language problem, like a receptive aphasia. She can even name individual letters if you point to them. And here is the big clue. She has a right hemianopia. That means she's lost the entire right half of her visual field in both eyes. So here's the million-dollar question. How do we put all these bizarre clues together? Well, the answer isn't in her eyes, and it's not in her hand. It's in the specific neural pathways that connect vision to language. To solve the case of Miss Jensen, we need a map of the brain's reading network. So let's pull up that map. We're going to trace the normal journey that a written word takes, from the page all the way to our understanding. Okay, let's walk through this pathway. Step 1. Anything you see in your right visual field crosses over and gets processed by your left visual cortex in the back of your brain. Step 2. And the opposite is true. Your left visual field goes to your right visual cortex. Now here's the crucial part for reading. For almost everyone, our language centers are on the left side of the brain. So that information from the right cortex has to get over to the left. How does it do that? Step 3. It crosses the midline through this thick cable of nerve fibers called the splenium of the corpus callosum. And finally, step 4. All of this visual information about words comes together at one critical hub, the left angular gyrus. You can think of this as the brain's command center for both reading and writing. So now that we know the normal route, we can figure out what happens when there's a roadblock. Let's see exactly how a break in the circuit leads directly to Miss Jensen's symptoms. This is our diagnosis. Alexia without agraphia, or what we call pure Alexia, and it's a classic example of a disconnection syndrome. The angular gyrus itself, the writing center, is perfectly fine. That's why she can still write, but it's been completely cut off from all incoming visual information. The best analogy is to think of the angular gyrus as a factory that's running perfectly, but all the delivery roads leading to it have been destroyed. No raw materials can get in. Now, this slide is super high yield because it shows the 3 main ways this disconnection can happen. Mechanism number 1 is the classic cause. It's a double whammy. A lesion in the left occipital cortex, which causes that right hemianopia, and a second lesion in the splenium, which blocks the info from the other side from crossing over. Mechanism 2 is pretty similar, it just hits the visual pathway a little earlier. But look at mechanism number 3. You can get the exact same Alexia with a single, deep lesion, but with no visual field cut at all. That's a key point to remember. And what causes that classic double hit from mechanism 1? Well, most of the time, it's actually a single event, a stroke in the left posterior cerebral artery, or PCA. This one artery just so happens to supply both the left occipital cortex and the splenium. So one blockage gives you 2 critical hits, and suddenly the full syndrome of pure Alexia just appears. Okay, so as a clinician, when a patient comes in and says, "I can't read," you have to think through a few key possibilities to make sure you land on the right diagnosis. The absolute most important distinction you have to make is this one. If the lesion takes out the left angular gyrus itself, a direct hit, you get Alexia with agraphia. The patient can't read and they can't write. But in our case, pure Alexia, that gyrus is spared, so writing is preserved. It's all about location, location, location. And you'd quickly rule out these other conditions. It's not a receptive aphasia, because like we said, she understands speech perfectly. It's not neglect, because she isn't ignoring one side of the word. She sees all the letters, she just can't put them together. It's definitely not dementia, because all her other thinking is sharp. And finally, it's not developmental dyslexia, which is something you have your whole life, not a sudden loss of a skill you once had. All right, let's boil this all down into some must-know clinical pearls, and then we'll test our knowledge with a few quick cases. You absolutely have to know these 4 things. 1. Patients often try to compensate by reading letter by letter, sounding things out almost. 2. The left angular gyrus is your hub for reading and writing. 3. Pure Alexia is a classic disconnection syndrome. And 4. The usual suspect is a left PCA stroke. Got it? Okay, first case. You have a patient with pure Alexia. They can write, but can't read. But here's the twist. Their visual fields are totally normal. So where's the lesion? This is that third mechanism we talked about. A single, small, deep lesion in the white matter, right underneath the angular gyrus, can knock out that final common pathway of visual fibers just as they arrive, sparing the visual cortex completely. All right, next one. A patient suddenly can't read or write. What's the one spot in the brain that would knock out both of those functions at the same time? Exactly. This isn't a disconnection anymore. This is a direct hit on the command center itself, a lesion right in the gray matter of the left angular gyrus. Let's put it all together. You get a call from the ER about a patient with an acute left PCA stroke. What 2 classic findings are you immediately going to check for in your exam? That's the classic pair you're looking for. The inability to read, even though they can still write, plus a loss of the right visual field. That is the signature of a left PCA stroke, hitting those specific structures we've been talking about. Okay, for your final rapid-fire recap. Pure Alexia means you can't read, but you can write. The cause? A disconnection of the visual cortex from the left angular gyrus. The classic sign to look for? A right hemianopia. The classic cause? A left PCA stroke. And if both reading and writing are gone, the lesion is in the left angular gyrus itself. And I'll just leave you with this to think about. Pure Alexia reveals something really profound about our brains. The ability to just see a letter is a totally different neural process from the ability to instantly recognize a whole group of letters as a word. This one syndrome beautifully slices those 2 processes apart, leaving us with a much deeper appreciation for the absolute miracle that is reading.